Hello, everyone, and welcome to another episode of our podcast. Here we have very honest, empowering conversations about health, about wellness, and really everything in between. And as we all know, October is Breast Cancer Awareness Month, and today's episode is going to be a very special one. We're joining voices with an expert and a survivor to raise awareness, to encourage early detection, and also to remind every listener, men and women alike, that knowledge truly saves lives. So joining me today is Dr. Judith Naa Ode Tackie, a well-seasoned oncologist who is a doctor who specializes in cancer at Kolebu Teaching Hospital, and she'll help us to understand breast cancer from a medical perspective. She'll tell us about the facts, the risks, and also the importance of screening. And then we'll also hear from Madam Fafa Gozo, a very brave breast cancer survivor, and also the founder of Jidula Pink Foundation. Madam Fafa's journey reminds us of the power of faith, of hope, and of timely care. So together, we'll talk about prevention, we'll talk about the early signs that you should look out for, and then also treatment, and also very, very importantly, the emotional side of the journey, because awareness isn't just about pink ribbons, it's about empathy, it's about strength, and also about action. So stay with us as we dive into the conversation. Thank you so much for joining me, ladies. Doc, I think I'll start with you. We're in Pink October. I'm sure most of the people watching us have seen all over social media, breast cancer awareness. But we want to know, what really is breast cancer? Are there different types of breast cancer? How do they differ? Tell us about it.
Okay. So the breast is made up of cells, and these cells grow and die in a controlled way.
Okay.
Sometimes these cells grow uncontrollably. Okay. And when this happens, a lump forms. Okay. And what makes it cancerous is that these lumps have the tendency of spreading not just in the breast, but to other organs in the body.
Okay.
And yes, there are different types of breast cancer, depending on where the lump develops.
Okay.
So we have those that develop in the milk ducts, and we have those that develop in the milk making glands.
Okay.
Those are referred to as ductal cancers and then lobular cancers.
Okay.
And apart from looking at classifying cancers by where they grow, they are also classified based on their biology.
Okay.
If I say biology, I mean how the cells behave,
okay.
How aggressive the cells are. So we have those that are hormone receptor positive. That is, they respond to hormones, or they feed on hormones. So they feed on the female hormones. So giving treatment that reduces these hormone levels are able to control those with hormone receptor positive breast cancer. And then we have those that are HER2 positive. If I say HER2 is a marker on the cell that gives signals to the cells to keep growing. Okay. So when the cells are looked at under the microscope and they have these signals on them, they're classified as HER2 positive. And given treatment targeted at these markers can help control the rate at which these cells grow. And then we also have the very aggressive type, which is a triple negative breast cancer. Those are neither hormone receptor positive or HER2 positive. So they don't have any markers at all. Those are the very, very aggressive types. So basically, those are the common types of breast cancers we have.
Wow, thanks, Doc, for this education. I'm sure most of us didn't know that there are even different types of breast cancer. But then we also want to know, Doc, tell us, what are some of the early signs and symptoms that people should look out for when it comes to breast cancer?
Sometimes there are no symptoms at all. That's why a lot of people tend to report late.
Right.
And then that's why screening is important, because sometimes you might not have any symptoms at all, because the lump is probably hiding somewhere your hands cannot feel. And it's only through screening that the lump can be picked up. So usually there are no symptoms at all. Or you might have a lump a painless lump in your breast. It could also present as a lump in your armpits. Some people think they are balls and then treat them for a long time, and then finally it turns out to be cancerous. So you can have the lump either in your breast or in your armpits, or you can notice skin changes in the on the skin of the breast, a change in color of the skin, and then also changes around the nipple, maybe a rash around the nipple, the nipple retracting inwards, nipple discharge. And when it gets to the stage where you have the skin of the breast looking like the back of an orange, which is referred to as podorange, then the disease is quite advanced. So commonly, these are the common signs that you can pick up in your breast that might indicate that you might be dealing with breast cancer.
So that tells us the importance of screening then. So how often should one get screened? I know screening is something that is highly recommended. How often should that be? And at what age can one start to get screened for breast cancer? And this is not for only women, but men as well, isn't it?
Yes.
Yeah.
So there are different screening methods.
Okay.
We have what we refer to as a self-breast examination. And every woman is encouraged to pick a day in a month. If you're still having your menses, we advise that you take 5 days after your menses, when your breast is less lumpy and painful, lie down, learn how to do the breast examination well.
Right.
Those who are menopausal can pick any day in a month to do their examinations.
Okay.
So that is for self-breast examination. And then we have what we call clinical breast examination. That is, you go to a health professional, a nurse, a doctor, to examine your breast properly.
Right.
Because you might be missing something.
Yes.
So once a year, we encourage women to go to the clinic and then get a nurse or a doctor examine their breasts. And then we have the diagnostics, mammograms. So the recommendation is that every woman who is 40 years and above should get a mammogram, either yearly or every other year. Those below the age of 40 who have a high risk of developing breast cancer, we advise that they do either ultrasound or MRIs. So this screening outline is for the general public. However, for those who have a high risk of developing breast cancer, those with a positive family history, those people are at a higher risk of developing breast cancer. So they start their screening quite earlier.
Okay.
So by the age of 25, you should start getting screened.
Okay. So this goes to say that screening is important for everyone, but if there's a family history of breast cancer, then there's a need for you to be more aggressive about the screening. You need to start from the age of 25, you said, they can start their screening, and to make it a habit, right?
Yes.
To make sure that you're always getting screened.
Yeah.
In this month of October, which is Breast Cancer Awareness Month, I'm aware that there are several clinics, facilities, and even organizations that are offering free breast cancer screening. Some diagnostic centers are also offering discounts on mammograms and ultrasound. So this is a perfect time for you to go out there and get screened and to get your mammogram done. Livingstone Foundation, I can speak for us, which is Stoneboys Foundation, has an annual free breast cancer screening, which is done every year. And this is a great, we have people that come every year and they know that they're going to get their free breast cancer screening. So this is a great time to get your free breast cancer screening. Okay, Doc, so when it comes to the treatment options for breast cancer, what are the options that there are for patients that are diagnosed?
So the treatment options for breast cancer depends on the stage and the biology of the disease.
Right.
So when I say stage, I mean the size of the lump, if there are lymph nodes in the armpits, and whether the disease has spread to other organs or not. So depending on the stage and how aggressive the disease is, that determines the treatment options that are available for you. So for those with early stage disease, so there's surgery where the lump can be taken out and your breast conserved, after which you might have chemotherapy or not. And then depending on the biology of the disease, if your disease is hormone receptor positive, you'll be put on hormonal tablets for about 5 to 10 years. Once you get your breast conserved, you need to have radiotherapy. So those are the treatment options for those who present with early stage disease. However, if you come with advanced disease when the lump is quite big and doing surgery upfront is not possible, then we need to give you chemotherapy. That is cancer medication that is given IV to shrink the tumor, to make surgery possible, either to conserve your breast if possible or to take the breast off. That is mastectomy. And then after that, once the disease is advanced, you need to have radiotherapy and you need to have chemotherapy. And then depending on the biology of the disease, whether you're going to have targeted therapy, targeted at the markers on the cells, whether HER2 positive or hormone receptor positive, then you need to have that treatment.
Wow, thank you very much, Doc. That was very insightful. Now we know the different treatment options that there are. But as we say, prevention is better than cure. And so we would always want to prevent the disease from happening. So are there any lifestyle changes that we can employ to, take ourselves out of the group or the risk factors that could lead to breast cancer?
Yes. So there are modifiable risk factors.
Okay.
So healthy diet is one thing that you can do to reduce your risk of developing breast cancer. So eating well, balancing your diet with vegetables, fruits, reducing carbohydrates, getting proteins can help reduce your risk of developing breast cancer. So exercise, maybe 30 minutes, maybe twice a week should be fine.
Right.
Because it's been found that those who are overweight, the fat cells have the tendency of converting to estrogen, which is the food that these cancer cells feed on. So once you are overweight, your risk of developing breast cancer is high. So if you are eating well, you're exercising, that would help maintain your weight. And then also, if you can reduce alcohol intake, you do. If you smoke and you can stop, we encourage you to stop because alcohol intake and smoking are all risk factors. And then oral contraceptive pills. Even though the risk of developing breast cancer using oral contraceptive pills is very low, it's also a risk factor. So if you can consider other types of birth controls, you can do that. And then if you're on hormone replacement therapy and it's possible to stop, you do that. And then we encourage women to breastfeed because it's been found that breastfeeding reduces your risk of developing breast cancer. So breastfeeding for 12 months at least is protective. So these are modifiable risk factors. And once you are practicing these, your risk of developing breast cancer is reduced.
Wow. We're learning a lot today from Doc. Doc, you mentioned one of the main risk factors being a family member with breast cancer. So when it comes to genetic testing, how helpful is that?
Genetic testing is very helpful because it helps one identify their risk of developing breast cancer. So if you have a family member, we say first degree relative, so a mother, a sister, a daughter who has either breast cancer or ovarian cancer, you might be at risk of developing breast cancer. Or if you have multiple relatives with cancer, prostate cancer, breast cancer, ovarian cancer, pancreatic cancer, you might be at risk. And then if you have a relative who developed breast cancer at a very young age, you might actually be at risk of developing breast cancer. So genetic testing is essential once you fall in any of these categories.
Right.
There's the BRCA1 and 2 mutation test. You can take it to find out if you have a high lifetime risk of developing breast cancer. And once you do, it helps you adopt these preventive lifestyle changes and then also early screening so that if you develop the disease, it can be picked up early, you get the right treatment, and then you can go on with your life.
Yeah, I think that's very true. And mental health is getting or gaining a lot of attention these days, thankfully. And I would like to know, does mental health play a role? Does it have any role in the recovery process for breast cancer patients?
So mental health is very essential when it comes to the management of breast cancer. And it's been found that patients who have support systems, family members supporting them, friends supporting them, survivor groups supporting them, they cope well. They tend to be more adherent to their treatment schedules, and they tend to do better. So psychological support is very important when it comes to the management of breast cancer patients. So we encourage friends, relatives to give patients with breast cancer this support. And also adopting stress-free lifestyle is also very important. And this can only be done when you have that support around you.
Yes, that's very true. I totally agree, because sometimes we underestimate how important mental health is in all aspects of our life. So this is also very true, and I think it's something that we need to pay a lot of attention to. Okay, so Auntie Fafa, I'd like to come to you now, our very brave breast cancer survivor. Thank you so much for taking the time to join us. But this question has been on my mind. I want to know, how did you find out that you had breast cancer?
Okay, so I'll begin by saying my day started that day like any other day. I woke up going about my normal house duties, and when I was getting ready to leave for work, I was prompted that I didn't have enough milk for the baby. So I decided to express before leaving. But unfortunately, my pump didn't work. So I had to do it the manual way. Then I detected something, a very tiny lump in my breast. But I realized it was very hard. So I got alarmed. But because I was running late for work, I just ignored it and left. 2 weeks later, I remembered and decided I was going to get it checked. I went to the hospital. One thing led to the other, one test to the other, and finally the results came out and I was diagnosed with invasive carcinoma.
Wow.
You won't want to, I don't know, but you can only imagine how I felt that day. It was like my whole life came crashing right in front of me. Because the first question that came on my mind was, breast cancer with a baby? How am I going to survive it? It was very devastating. It was a very difficult one. Yeah.
Wow. This is very emotional. So I can imagine that this must have been a very challenging period for you. But I'd like to know, what was the most challenging part of your journey with breast cancer?
Okay, the most challenging part was the chemotherapy and the surgery. Because chemo was very harsh on the body.
Yeah.
And from what I had read earlier about treatment, I was told, or I learned, it affects your kidney, your organs in general. So the question is, you end up treating breast cancer and then you end up destroying your organs. Should I do it or not? So the first thing I did is I resorted to the herbal treatment. Yes, I will. I resorted to the herbal treatment because from what I had heard, everybody was like, oh, everybody I know who did chemo lost the battle. So there's no need even doing chemo. So I went to a herbal hospital. I spoke to the herbalist. He gave me a lot of things to come and take at home, which I did. But after some time, I realized the lump was getting harder and it was increasing in size. So I called him and he said, some cancer cells are stubborn. So mine is the stubborn type. And I was like,
wow,
how come you didn't say all of this
from the beginning?
From the beginning.
Yeah.
And I just told myself, okay, it's time to go back to the hospital,
right? Which
I did. So I started with chemotherapy. I actually went for counseling before I started the treatment in general. So I had a fair idea what to expect and what not to expect.
Yes.
Chemo was very harsh, but I knew what to do and what not to do. So I went through. After chemo, I had to do a surgery. And that was the most difficult part because I kept having nightmares about dying.
Right.
The voices kept coming.
Oh, no.
When you go to that theater, you're not coming back. When everyone is asleep, that's when the voice comes louder. Yeah. So it was very difficult. At a point, I said, okay, I'll do it next week. And then I changed it again. And I postponed it to another week. But after some time, my husband was like, no, we have to do this once and for all.
Yeah.
And he kept saying, it's better to try and lose than not trying at all. So I ended up at the theater and I took the whole breast out because at that point, it looks like things were very bad.
Right.
So they had to take the whole breast out. Yeah.
That must have been very difficult.
It was. Yeah. After that, I went back for radiotherapy, which I did for 6 weeks. When I thought everything was fine, the doctor now said, you have to go back to the theater to take your ovaries and your fallopian tubes out. Because in my situation, I shouldn't produce estrogen.
Right.
So once you have your fallopian tubes and ovaries working, you definitely produce estrogen.
Yes.
So I had to go back to theater and take those things out. And that has forced me into early menopause. And as we all know, the side effects of early menopause, mood swings here and there. You're happy, the next moment you're sad, and all of that. But to God be the glory, I went through everything. And this is me sitting right here.
Thankfully, we still have you here with us.
Oh, yes.
We're enjoying your beautiful smile and your amazing energy. When she walked into the room, she walked in with the biggest smile, and she's keeping all of us happy. We're glad that you're still here with us.
Thank you.
We're glad that you're still here with us. So I'd like to know, bordering on what Doc said about having a support system and really the importance of mental health. Did you have that support system, and how important was it? What role did that play in your recovery process?
Okay, with the support system, I had it all.
Wow.
My husband was there, my sister was there, and family was there.
That's great.
They were there for me. Yes. So with the support system, I had it all, and it really helped because at every point in time, I had someone telling me, this phase 2 shall pass. It's a difficult one, but you're doing well.
Yeah.
I go for chemo, I come back, and maybe my sister can just say, oh, today we bought you this because you did one session very well. We are waiting for the next. My husband comes home and he's like, oh, next week we are going for chemo. Like there was always that encouragement and inspiration I needed.
Yes.
What I really look at or what I felt gave me the inspiration I needed was my baby.
Oh.
Apart from my husband and my child and my sister and the other children, when I look back at my baby, I'm like, if something happens to me now, what is the baby's fate?
Yeah.
So if not for anything, you have to be strong for that baby.
Yeah.
Exactly.
Yeah. So the support system was very important. And I'm grateful I had it all. Because without that support system, I don't think I would have made it this far. I don't think I would have made it this far at all. Because on days when I even felt I was losing myself, they were there to tell me, no, you can't give up at this time.
Yeah.
We are all in this.
Right.
And for any woman or every woman out there who is going through this, I would advise family members, friends to always be there for them.
Yeah.
Because the support system is one most important thing we all need.
Yeah.
It's very, very important. For your mental health, your emotional being, it's very important.
You're very right. The impact that support systems create or play in the lives of cancer patients is one that should never be underestimated. So if you are watching us, you have any family member, any friend, any colleague, anyone you know who's going through their walk or their journey with cancer, do not underestimate the role that your support, your kind words, your encouragement plays in their lives. It's actually the fuel that keeps them going. So please do not underestimate what your support is doing for them. So Auntie Fafa, I'd like to know, how has surviving breast cancer changed your outlook on life when you look back at it?
Surviving breast cancer has given me a different perception about life. Yeah. Because there are lots of things we all take for granted. We tend to look at the problems and forget about the good things that happen.
Yeah.
We always dwell on what is not going on right and forget about the ones going on right.
Yeah.
Since my recovery, I have seen life in a different way. And this time it's not just about living, but living with purpose.
Yes.
It's not just about living,
Yes.
but living with purpose. Because I tend to appreciate life more now.
Yeah.
Not until things like this happen to you, you take a lot of things for granted.
Yeah.
But when you get there, what the doctors are telling you is 50-50. And you are now asking yourself, okay, let me try. If I lose, that's it. If I win, my gain.
Yeah.
So this has just changed my perception about life. And this time, I'm living with purpose. And that is why I'm sitting here.
Yeah.
Initially, I didn't even want anyone to know I was going through this. So it was just my husband, my sister, and our 2 friends. Even my parents didn't know.
Wow.
Because I was scared.
Yeah.
I didn't know how they were going to take it.
Take it, yes.
It was after some time I realized, no, it is time to let them know this is what you are going through. And I was scared because of the stigmatization.
Yeah.
People are just concerned about, have you heard? Have you heard? Have you heard? Have you heard? Not thinking about what you are going through.
Yes.
Yeah. So with the stigmatization, I think we have to put an end to it.
Yes.
It's very bad.
Yeah.
Yeah.
Please. We don't sit here just to talk about the topic, but we're learning about the parts of the struggle that we otherwise would not know. So, yes, the gossip here and there, these are things that people would naturally want to do, but turn that around into support. Instead of calling someone to find out, have you heard, like Auntie Fafa is saying, why don't you go out to reach out to the person and offer support, offer help in any way that you can? And that would go a long way to help even in the recovery of your friend, your colleague. You never know. So talking about living with purpose, as you said, I know that you have a foundation called the Judith Foundation. And when I heard the name, I was so happy. And I said, how can I support? Because that's the name of my daughter. And so please tell us about the Judith Foundation and what you're doing. I know you are involved in a lot of advocacy since your recovery and also some support groups. So tell us about it. How can people support? How can people come on board?
The Judith Foundation is my foundation.
Okay.
And I spoke about living with purpose.
Yes.
I asked myself, after all you've been through, what next?
Yes.
What can you do with this pain? And I said, no, I have to turn this pain into purpose.
Yes.
And that is how come the Judith Foundation came about. So we are into creating awareness and education. When we look back at our communities or people who live in the villages, the message about breast cancer is not there yet. Everything is just in Accra.
Yes.
So we have decided to take it to the villages.
Wow.
And I'm going to start from the Volta region.
Wow.
The Volta region, because that is where I come from.
Yeah.
Charity, they say, begins at home.
Of course.
Yeah. But before then, I do a lot of advocacy, community advocacy. People invite me. We do Zoom. We try to educate people and create a lot of awareness.
Wow.
Yes. And what I want to do now is try to raise funds. Because in this month of October, by the time people are done with the screening, you'll be surprised and amazed at the number of people who will be diagnosed and need help.
Yeah.
So what we, the Judith Foundation, is trying to do now is creating awareness, education, and raising funds to be able to support those who will be diagnosed in this period of October, which is the Pinktober. So that's what we've been doing so far.
Wow, Auntie Fafa, this is such great work you're doing. I must commend you.
Thank you.
Because you didn't just recover and go back to your life. You are deciding to live with purpose.
Yeah.
You're deciding to create impact in the lives of those who otherwise may not have been presented with the opportunities that you have.
Yeah.
That's really amazing. So for someone watching us who has been newly diagnosed with breast cancer, what advice are you going to give them?
The advice I'm going to give them is there's hope.
Yeah.
There's hope.
Yeah.
It's difficult, but it's doable. You need a positive mindset. You need a grace factor. I tell people when I talk about the grace factor, it's not about church. Mm-hmm. It's about your personal relationship with God. It's not about church. It's about your personal relationship with God. You need a grace factor. You need support, a solid support system. So to anyone out there watching us, my advice to you is there is hope. It is difficult, but it is doable.
Yes.
It is difficult, but it is doable. To add to that, our advice, the person tries to change his or her lifestyle. Mm-hmm. That is very important. The things we eat, the things we drink, let's be intentional about it. Mm. You can't be doing or undergoing cancer treatment and still eat sugar, still take soda, and all of that. Doc said initially you have to reduce your carbohydrates intake and all of that. So it requires a total life change. Yes, everything about you changes because life after cancer is never the same. Mm-hmm. No matter what you do, your life after cancer is never the same. So you just have to psych yourself, be positive, and know there's hope.
Yeah.
Thank you.
That's great. Okay, Auntie Fafa, so as we round up our conversation, how do you think that communities can better support those who have been affected by cancer? Because we keep talking about support, and it is not just on an individual basis. As communities, we should be able to support those who have been affected by cancer. How do you think that this can be done successfully, of course?
Okay, before this can be achieved, the communities must understand what is happening.
Right.
If they don't understand, they can't offer support. So before we take it there, I would advise we create more awareness and education. Because the more they understand what cancer is, the more they understand the importance of support, they can give it. So the first approach to that is we need to create more awareness and education. Once they understand, then they can now offer the support the individual needs. So it has to start from creating more awareness and education. So when they understand, then they now know, oh, Fafa is going through this, and this is what she needs from us. But if I don't understand what Fafa is going through, I won't be able to give her the support she needs. So by creating more awareness and education, they would also get to understand better, and then they can help better.
That's very true. And this lies on all of us to try to create awareness. If you have a friend, a colleague, anyone you know who has been affected by this condition, as well as you're showing, if you have any colleague, anyone you know who is going through the struggle with breast cancer, not only are you going to offer your support to them, but you're also going to sensitize everyone around to be sensitive to the condition that the person is currently going through, and then also to offer support. So I think that this is very true and it's very important. Thank you so much, ladies, for joining me for this conversation. It's been very insightful, and I think that our viewers have also learned a lot, and we're going to go on and pass the message on. We're not just going to gatekeep. We're going to pass the message on to friends and loved ones and everyone around us. Thank you so much, ladies, once again for joining me today. I have some gifts for you. Auntie Fafa, this first one is for you. I have some products from Unichem Ghana. The first one is VitaFizz. I know you are very much into natural herbs and all things natural. So this is actually an immune support or an immune booster. It contains vitamin C and zinc, and then also some natural herbs like ashwagandha, tulsi, and then ginger root. And it's very good for detoxifying the body and also increasing energy levels, which is something I know you like to have. So I have that in here, and I have some other goodies in here. It comes with a shaker. Usually when you buy it in the pharmacy, it comes with this shaker, so you put it in there and then you sip all through the day. And I also have some other fun goodies for you.
Thank
so
you.
This is the first one for you, and then I also have a rice cooker for you. I know you've told us to cut down on our carbs, so you're going to be cooking brown rice and black rice in this.
Exactly.
So this is something small for you, and thank you so much for coming on the show.
Thank you too.
All right, Doc, so I also have a package for you. It's got a lot of goodies in there. My favorite, of course, being VitaFizz. As you know, it has all of these natural herbs like ashwagandha, which helps with anxiety and so on. So this is something small for you from Dinikem Ghana, powered by Luwex. Thank you so much for joining us.
Thank you.
All right, guys, thank you so much for joining us on this episode of our podcast. We've learned so much, and I believe that we're going to pass the message on. It's still Pink October. Take advantage of the season, get screened, go out there and spread the word, and we'll see you on our next episode. Bye.
Okay.